Going in depth to find out what's next for our communities as we rebound Tampa Bay.
Telephonic Health, which is basically medical care via your cell phone, has helped thousands of Floridians during the pandemic.
But as State Capitol reporter Forrest Saunders shows us, some patients and doctors are concerned the option will disappear as soon as the virus does.
Nathaniel Prada lives with severe anxiety, fears of COVID-19 worsening his condition.
Even the thought of going into a clinic full of individuals, who might be sick, that's just not a possibility in my mind.
A saving grace, Telephonic Health, helping Prada get care without risking infection.
Without telephonic services, I would probably go without.
The service is essentially a phone call instead of an in-person doctor visit, previously unavailable due to privacy concerns. Florida foregoing those concerns through a state order as virus cases spiked in March.
I receive a phone call at the set time, and it's like any other visit.
The change is only temporary. It'll end when the order does. But during these last few months, it's opened up Telephonic Health to thousands of Floridians like Prada, many of them low income, unable to afford the cost of data plans needed for video-reliant telehealth.
If the option, is no contact at all versus being able to maintain a telephonic or an audio-only telehealth communication with your provider, that's a win.
South Florida physician John Newcomer is trying to make the change permanent. He says Telephonic Health has been a game changer for mental health services specifically. The Florida Association of Managing Entities says it saw a 300% surge in telephonic use across its 300 providers, 21% of patients choosing it in April alone.
During this pandemic, we were able to maintain about 98% of our service volume.
To keep telephonic care, Newcomer will likely need lawmaker and health agency support and to sway critics who argue limiting doctor-patient interactions to just phone calls will seriously compromise care quality.
There's some really great conversations taking place now, both at the state and federal level, to consider ways to maintain this flexibility.
Doing so could ensure patients don't fall into cracks, exactly what Prada says would have happened to him if not for the telephonic option.
I would have made the decision to tough it out, as we always say.
At the Capitol, Forrest Saunders, ABC Action News.